I'm Howard, and I make stuff for BBC Reel. For a long time now, can't quite remember when it first started, my legs and arms seem to have been gaining minds of their own. No, I'm not talking about learning algebra or reciting Nietzsche. I mean, they seem hell-bent on making me want to go and run a marathon in the middle of the night, or go and play tennis when I'd rather be in bed.
Surely not, I hear you cry. That's impossible. Cut down on the caffeine and the sugar.
Well, it's actually a condition of the nervous system called Restless Leg Syndrome, or RLS, aka Willis-Ekbom disease. It can affect around 10% of people globally.
There's actually a bit more to RLS than its name suggests. I also get it in my arms, and normally only in the evening and at night. It can be unbearable and overwhelming.
Thankfully, mine is quite mild, but it can last for hours. It can lead to very little sleep and become pretty debilitating, especially for those who suffer from it very badly. The causes could point towards some genetic factors at play. Professor Claudia Trenkwalder is a pioneer in RLS research. She suggests that those who develop it may already carry some genetic traits that may make symptoms more likely to develop.
For developing restless leg syndrome, I think you need two factors. You need a genetic background, and there are up to 23 gene variants known now. You need at least one or maybe two, or an interplay between some of these variants. But then there is also the need for an environmental factor.
Julian Spinks is a general practice doctor in England and the chair of the charity RLS-UK. He also suffers from RLS himself.
There are two main variants of restless leg syndrome. The first is a standalone condition where people tend to develop it most severely in middle life and onwards, but about a third of people say that they developed it before the age of 20, so it can be a lifelong condition. The second variant of it is secondary restless leg syndrome, and that's where there's another condition which tends to cause it. And the most common ones of those are iron deficiency, chronic kidney disease, and unfortunately some women develop it during pregnancy, and it only goes away when the pregnancy is finished.
I got in touch with another sufferer of RLS, Julie Gould, to compare our experiences. While not a medical professional, Julie is what's called a patient expert, and recently had an article published in The Lancet calling for better training in RLS symptoms for UK healthcare professionals.
Imagine I was a wire cog being wound up, as tightly as can be, and then no release. That's the nearest I can equate it to, someone winding my body up so tightly that the only thing you can do is let the energy release, but it just didn't release. So it was unbearable, and an internal feeling of just wanting to, my whole body wanting to scream. And the only release from that tension was to physically harm myself, because the pain was preferable to that unbearable, tense, wound up, creepy, crawly sensation. It's impossible to describe.
Now, there are a host of treatments available depending on severity. First of all, sleep hygiene and a good night's sleep is vital.
Some people also find things like hot baths or showers, or even cold showers, can make a difference. So we will start with that because we want to try and reserve the medication for later. Amongst the medications, the one that's been used the most are called dopamine agonists, and these are a group of drugs including pramipexole, ropinirole, and a patch called rotigotine.
When I was first diagnosed, I was put on diazepam for about 6 weeks, and it worked very well. Then it stopped working, and my MS neurologist at the time said there was a wonderful new drug available called ropinirole, and that he would prescribe that. Sure enough, it was miraculous. The first night I took it, it stopped all those horrible, unbearable sensations, which I was been getting every night, and I could sleep. Fantastic. Fast forward 14, 15 years, and augmentation of symptoms set in. The doctors just shook their heads, didn't know what I was talking about. And I said, it's got worse. It's become so intense. It's unbearable. I can't sit still in the day.
Ropinirole is from a group of drugs called dopamine agonists. Now, this kind of drug can help reduce RLS symptoms in the short term, but has been found to cause augmentation, the worsening of symptoms, in the longer term.
Julie went on to explain that after being prescribed further drugs for her condition, her symptoms only got worse.
The only thing you can do is to slowly reduce the medication, and you'll probably need opioids to help. Augmentation and withdrawal from dopamine agonists. It was the most horrendous experience of my life. I nearly did not make it through. I seriously considered suicide. I'm a very logical person. I'm a lawyer. I've never been depressed in my life, never suffered anxiety, but it was so utterly unbearable. You literally get non-stop RLS symptoms in every part of your body 24/7. My symptoms are miraculously zero because I've done all my research and I've got on the buprenorphine, which has been absolutely miraculous.
Unfortunately, when you look at the guidance in the UK, it's still pushing people towards dopamine agonists. And the latest international guidelines from the Mayo Clinic are moving away from that and using the pregabalins and the gabapentins as well.
It all paints a rather confusing picture. Because RLS is still a poorly understood condition, awareness can vary, maybe depending on which country you live in or even who your doctor is. Here's Julian again to describe what the situation is like for general practice doctors, GPs, here in the UK.
Unfortunately, restless leg syndrome doesn't appear on the curriculum at medical school and in the postgraduate training, so it's very much depending on what you've met, what interests you do. Most GPs are aware of the condition and how to diagnose it. The problem comes with treatment, particularly when patients are running into difficulties, because they will be looking at guidance which actually is slightly out of date unless they know about the new international guidance.
So, what could diagnosis for RLS look like in the future?
I think diagnosis should always consider the entire human being, all comorbidities and all medical history, if you diagnose RLS for the first time. And then you should consider, what should I do? Maybe with the knee surgery, it's a problem that may start for some weeks until your knee is fine again. You are better giving no medication and just waiting or give some sleeping pills for 2 weeks and don't do anything not to induce the dopaminergic path here and to start with the problems of augmentation.
Well, I found this whole journey utterly fascinating and eye-opening. It seems awareness and research into RLS is slowly changing the landscape, but not nearly fast enough considering how common this condition seems to be. Here's Dr. Julian Spinks with a final few words for anyone who thinks they might be suffering from RLS symptoms.
Often I find that people will delay going and seeking help, often until their restless leg syndrome is really quite severe. And I think it's because often they may not have heard about it, or they may have previously seen a doctor who actually misdiagnosed it. What I would say is that, if it's getting to a point where it's really interfering with your life, do go and seek help. I'd also recommend having a look at websites, including the RLS-UK website, which will give you information that you can take to your doctor to perhaps convince them that this is the condition. But don't suffer in silence. It is something that it's worthwhile seeking help for.